Good morning. My name's Stuart, Nottingham at Sun Rehabilitation. I'm delighted this morning to have Lasse Flosand with me. He's our resident expert on long COVID, and he is running long COVID rehabilitation plans on our behalf very successfully. So good morning to you, Lasse.
Good morning. Thanks for having me.
Well, yeah, it's great to have you on board with this. Can you tell us a bit, what is long COVID? What symptoms are you seeing coming through?
So to understand long COVID, you have to very briefly perhaps talk about COVID as a whole. COVID-19 is a virus that seems to hold the potential of causing inflammation to virtually every organ in the body, which means that we could see people suffering with every single symptom under the sun, including inflammation of the central nervous system, skin, eyeballs, toes, joints, heart, lungs, stomach lining, and so forth. And whilst we expect the majority of people to recover from COVID within, let's say, 2 to 3 weeks and be back to near enough normal at that point, we see a proportion of people that will have symptoms that will be more prolonged after that point. There's a couple of definitions out there. We talk about post-acute COVID syndrome, where people have symptoms that last for up to 12 weeks and then recover. And then long COVID is then considered people who have symptoms and problems lasting for longer than 12 weeks. And these are the current definitions that we work by.
Okay, that's brilliant. So what are you doing as far as rehabilitation plans to actually help these people?
So it's very much an individual approach. So, excuse me. So again, as COVID can affect every single organ of the body, it is important that we assess and treat people very much individually. So we use a screening tool with people, first of all, which is called the COVID-19 Yorkshire screening tool. And in that tool, we actually assess a whole array, a wide base of the, well, we say the presentation of people. So we cover everything from swallowing and eating and pain and breathing and fatigue and so forth, to get a really good idea of all the potential problems that a person might be suffering with. And anxiety and mental health comes under this as well. And by using that tool, essentially, by the end of the assessment, you have an overview of the exact presentation and problem that the person is presenting with. And based on that, you then create a rehabilitation plan for that person. And that rehabilitation plan might be referring on for a, let's say, GP assessment and for further sort of NHS support. But also, you will find that a large proportion of people will also require physiotherapy input and rehabilitation for chronic fatigue, pain, and breathing problems. Even there's people who had cardiac issues and need cardiac rehabilitation. And also, in regards to people's mental health, we know that getting people back into a level of activity and normality and helping people gradually recover through a rehabilitation program is also very, very positive for people's mental health.
Yeah, so we can see over the next few months, when life returns to something that resembles normality, that work absence is going to be a significant issue. And
Yes.
As occupational health specialists, we are going to be working with businesses to actually reduce that incidence down as much as possible and return people safely back to work as quickly as possible. So how do you see rehabilitation programs being expanded to actually encompass businesses throughout the whole of the UK?
Wow, well, that's a big question. Well, I think you're right. I do think that employers might find that a level of their workforce is going to be having problems after having had COVID-19 and far beyond the weeks that would be expected, and that might impact on people's ability to be at work. I would say the way forward would be to ensure that you have a service that you can lean on. They'll be able to assess this group of staff and also to, at the same time, be able to rehabilitate them, to ensure that we can help people get better sooner. I think, can I add to that? I think sometimes it's easier than than a gym-based type of rehabilitation program. Sometimes, and I find this from experience, having seen a great deal of post-acute COVID and long COVID clients by now, that simple advice and reassurance actually goes a long way to help people recover, which is quite interesting. That we obviously use this remote format of rehabilitation, certainly to start off with, and find it actually quite beneficial. Even a simple phone call and just assess and screen people, identify what the problems are, and then start putting together a plan, a rehabilitation plan and a management plan in how to help people get better and how to enable them to get back to work. It just makes things much more effective in helping people recover following these type of problems.
Yeah, and integrating the case management along with the rehabilitation process, that's a key part of what we normally do. Do you see that part as the part of the long COVID process as well?
Very much so, and there are some very interesting learning points here. Again, we take a individual approach, so it's important to say that one approach doesn't fit everyone. But what we do find is that perhaps there's a trend of where you push people too hard to start off with after recovering from COVID. There seems to be certainly a degree of risk, an elevated risk of having setbacks, where actually people might have recovered largely from their COVID symptoms, come back to work too soon, too hard, back in normal duties, normal hours, and then 3-4 days later, they're off work again with new and emerging symptoms, shortness of breath and fatigue and all the rest, and people end up being off work for a long time afterwards. So I do think having a really good joined up approach with rehabilitation following COVID and a good return to work plan, good communication with employer, occupational health, and the client is essential. It really is essential. Yes.
So thank you for that, Lasse. That's it's interesting to actually see that something is positively being done for people with long COVID, because we do get the feeling, looking out around what's going on in March 2021 in the UK, that a lot of people are feeling abandoned and not a lot is there to help them recover and return them to a full operational upstanding workplace. So thank you for that information. If you'd like to know more about long COVID, please contact Sun Rehabilitation, and Lasse and I will be delighted to answer your questions. Thank you very much for your time.
Thank you.